why you're hearing from me. I'm just going to talk really briefly and turn it over to Linda, the head of the Women's Fund, but just want to let you all know that the Health Museum feels this topic is such a relevant topic to our community. And I'm so glad that we're having this session. We're hearing from some experts. As you can imagine, the Health Museum is closed right now. We are trying to decide when we can reopen. It probably won't be at least for another month or so, because we want to make sure we're aligning to all the proper guidelines and protocols. But when we do open, we're going to be very excited. And because we have two great exhibits. One is all called Outbreak. It's all about pandemics. Believe it or not, we've had it at the museum since September. And then another one we have is about artificial intelligence, which is actually being leveraged right now to help fight COVID. So we are excited to open. Don't know when we are, but in the meantime, we have lots of tools and resources on our website, thehealthmuseum.org. You can code check out. So with that, I will turn it over to Linda Rhodes. She's the Executive Director of the Women's Fund, and let her welcome the speakers. Okay, well, Linda, hopefully is on the call.
I don't see her.
She is having difficulty getting in. Just give us one moment.
We'll give her a minute, and since I started, I guess I'm going to wait, and if I need to, I can try to kick things off, but we'll see. We'll give her a minute. And of course, if somebody else from the Women's Fund would like to kick it off, they can as well.
I think Linda's coming on.
Great.
Thank you for y'all's patience. Linda. You're on, Linda.
Oh, hey, sorry about that. I had some trouble popping on. Thank you, John. I didn't hear a word you said, but,
Okay.
but we want to thank you again for being a partner with the Women's Fund. We can't wait to be back in the museum again. Hopefully you're going to be opening soon. So I'm Linda Rhodes. I'm the Executive Director of the Women's Fund, and we're thrilled that you're with us today. This is going to be an informative doc talk, and we're thrilled to be providing this information about vaping to you today. For 41 years, the Women's Fund has been providing and empowering Houston area women and girls to be advocates for their health and wellness. And we do this by providing free publications, classes, workshops, and lectures like today's doc talk. We're just excited to be in this space with you. It's a little different than being in the room, but we're excited to be here with you. And we know that you've all had to make adjustments to be here with us today. So we're grateful that you decided to tune in. I would also like to thank the John P. McGovern Foundation for providing the funding for today's program and for so many of our programs. Their support for over 35 years has been instrumental in the Women's Fund's success. 2019 was another great year for our outreach efforts. We brought programming to more than 11,500 women and girls like those of you on the Zoom meeting today throughout the greater Houston area. Additionally, we distributed close to 10,000 of our publications, all free of charge, to underserved and at-risk neighborhoods. Our ability to reach all these individuals and provide this would not be possible without partnerships of more than 150 program and 100 publication distribution sites in the greater Houston area. We know our work is vital for the community, and we're planning another record year this year. Don't know quite how that's going to look, but we're hoping for good things to come. At this time, I want to turn over the program over to today's moderator, a good friend who has been you probably used to see her on the news. She used to inform us about the weather on ABC Channel 13. She is currently the Corporate Citizen Director for Alliant Group. Casey, I'm going to turn it over to you now.
Hey, thanks, Linda. I always love working with Linda. Linda and I worked together when I first arrived in Houston. We won't say how long ago that was. We were both a little younger. And we worked with the American Heart Association. So I'm excited to be with you guys again. And really, this has become the format for everything now, right? I mean, I can imagine most of you are seeing your family this way, your extended family, your friends, and of course, all of your work colleagues. So we are really excited to bring this important talk to you guys. I have a 6-year-old, and a lot of my friends have kids that are pretty young, but I can only imagine how scary vaping is, the topic, the thought of it, if you've got kids who are a little bit older, even preteens. So I'm really looking forward to today's talk and learning more. So we have 2 amazing experts with us today. Bianca Smith, she is a licensed master social worker, and Dr. Lindy McGee, she's a pediatrician. I'll let you guys each introduce yourselves. I'm sure you'll do it better than I would, but both of you ladies, super impressive. I did, of course, research on you as being a former reporter, and some really looking forward to your insights today. So Bianca, why don't you start off?
Sure. So as you mentioned, Casey, I am a licensed master social worker and a substance abuse counselor in my full-time job, where I work with an amazing school district. I serve students ages 12 to 18. And on a part-time basis, I actually have a consulting company where the contracts range from case management to curriculum development. And I'm just honored to be here with you today.
And Dr. McGee, why don't you introduce yourself?
Hi, I'm Dr. McGee. I'm a general pediatrician and educator with Baylor College of Medicine. I help in a continuity clinic, a Harris Health County clinic with the residents from Texas Children. So I have a special academic interest in all the ways that we as pediatricians can prevent cancer later in life. So I've done some work with HPV vaccine, and then this led into vaping. When I started to hear my daughter, who's 16, and son, who's 14, talk about how much they are seeing vaping happening among their peer groups. So that made me worried, and as a mom, as a pediatrician, kind of got me interested in this topic. So I've been doing a lot of education, primarily of healthcare providers. So I'm excited to be educating just general public as well.
So first, we want to kind of set the stage and give a little bit of insight as to what vaping is. And I think we all have a basic understanding, but I can imagine that it goes beyond what those of us who don't vape and don't have anybody in our life that is vaping maybe really don't understand. Lindy, Bianca, one of you want to tackle that for us?
Yeah, and I'm going to share my screen a bit because I've got some visuals for you. So vaping is anytime you use a battery and a metal coil to heat up a liquid. So these are pictures of all different types of vape device. And we'll talk a lot about this one, which is a Juul. But this is a type of liquid you can put in. These little pods, hopefully y'all can see my arrow, little pods are different types. That's an example of a pod. And I think Bianca can tell you these are all things that she has confiscated from kids. So these are what our kids are using. They look nothing like traditional cigarettes. And the other thing to know about it is we call it vaping. It actually should be called aerosolizing, but vaping sounds cooler. So vapor is like, it's when liquid goes into gas form. So like steam from boiling water. If you breathe in steam from boiling water, you're fine. No problem with that. But vaping is really an aerosol, and that means there's a bunch of different chemicals that are in that that aerosol. So you know, it's more like what hairspray is, I think. But vaping sounds cooler, and the vaping industry knows what they're doing.
So, Lindy, some of these look homemade. Are they homemade, or they just don't look sophisticated?
I don't know, Bianca can answer that. So this is a Sorin device that is a really popular. Smoke SMOK are popular, and these are Juuls. I don't know about this one.
Just doesn't look sanitary, you know, like
I'm sorry. Yeah, and I'm sorry I was having trouble unmuting myself, but here's the thing. Some of them are modified, so that's probably why they look homemade. For example, if you look at the top left, that cartridge basically could have very well been a nicotine cartridge that they decided to basically pop open to fill with like THC, some other wax or concentrate. And you're absolutely right. Sometimes it gets so complicated that I literally have to pull students from in-school suspension or out-of-school suspension to say, I need you to show me this. I need you to show me how this works. I pull them into the conversation because they can get complicated. But the big thing I want you all to notice is just how discreet they are and how small they can be, and how as a parent, you may be cleaning or, just skimming through your child's room and see some of this stuff and just like, whatever. Maybe it's a piece to their cell phone or their charger or something. So that's the big thing. And they
These look
range.
like USB drives. I'm going to show you some other fun ways that they do it too while you're talking, Bianca.
Okay.
I'm sorry, we're all working with this Zoom here.
Sure. And the only other thing I'll add while Linda's pulling up other images is the modified devices, the ones that look homemade. Those are going to be the ones that I'm always most concerned about. Again, could have been purchased in a store as like an e-cigarette or a nicotine containing device that they've modified to include some other substance of choice. So we want to look out for any of those modifications or changes. And I'll let Linda go with the image.
Yeah, so these are super fun ways that you can get online to hide the fact that you're vaping. The hoodie there on the left is actually, you put the vape device in the back part of the hoodie, and then you can vape through the strings of the hoodie. It costs about $45 online. This one, to make it look like Tic Tacs, this looks like an Apple Watch. So, when there's a will, there's a way. Teenagers are inventive.
So you guys were talking about some of these can be modified, and that kind of leads us into what's in this exactly, or is it different? I mean, it can be different based on what kind you've bought and if you're changing it out for something like THC.
Yeah, so your basic elements of something that you're going to buy legally in Houston, Texas, it is going to have at very least something to suspend the liquid, and that's normally propylene glycol, and that's just the stuff they use on stage productions to make smoke. So that stuff is in there. Then there'll be stuff that you use, there'll be flavors. So even tobacco flavor is a flavor. So there's a bunch of chemicals to make the flavor. And then you also have to know when they heat those chemicals up, those form new chemicals. So it's not only the flavors that are in there, but the new chemicals. And then the ones you buy over the counter are going to have nicotine in them as well. But then, like Bianca's talking about, you can, as soon as you get rid of liquid in one pod, you can alter it to stick whatever you want in there. So we know that THC is super popular to put in there as well as they also sell CBD oil ones.
And so I heard you mention nicotine and CBD oil, THC. So are these addictive in the same way that other drugs are? I mean, I'm guessing they are.
Do you want to speak to that, Bianca?
Sure, and absolutely. So here's the thing, especially for people who are watching, because you are considering, or maybe you already vape or someone you love vapes, they were designed to be, okay? Everything from the design and the discreetness to the fact that you could literally modify not just the substance, but percentages, like how much nicotine, how much of a nicotine hit you want, how strong of a THC concentrate you want. They are absolutely addictive. And what I usually have to educate both my students and my parents on is even the psychological addiction, the physical addiction of just constantly putting this thing in your mouth. But these substances, many of us have heard that one pod or one cartridge contains about as much nicotine as an entire pack of cigarettes. If you sit down with someone and they told you, hey, I just stepped outside and finished an entire pack, you think, what? Like, how'd you go through an entire pack of cigarettes? But truth is, when they go through a pod, but even now, we're seeing everything from 3, 6, 8 milligrams all the way up to 36, 24, and 36, of course, which would be far more than a pack of cigarettes.
And the thing to know about the reason why this really took off, and I'm going to share my screen again. is because we, you can look at the numbers, and this really didn't take off until around 2013, 2014. And the reason why was because that was when Juul was introduced. And for one thing, Juul kind of looked cool. It looked cooler than the earlier devices. The earlier devices were made just to look like traditional cigarettes. But the big thing is that I don't think a lot of people realize is they patented their own nicotine salt. So this nicotine salt in Juul allowed it to have much higher concentrations of nicotine, and nicotine in a form that goes to the brain faster. So that is a large part of the reason why you saw this huge bump up in adolescent use right around that time.
And I'll add this to what Linda is saying. She's absolutely right. Like the fact that they literally patented their entire nicotine delivery system. If it helps, think of it this way: the way that their system delivers the nicotine, through the bloodstream into the brain, just increases the relationship between the action and the reward. That's why it's far more addictive. You get the hit. It's almost like they want a much more powerful hit, but they want it to be smooth. So Juul is very intentional about basically the mouth to throat experience. People wanting a smooth hit, but also a strong hit.
And didn't we hear, I feel like when this first came out, it was really touted as a way for people to kind of ramp down from smoking, as a smoking alternative, so safer than vaping. And yet now we're hearing about it really as something that's targeting young people, and in fact, if I'm not wrong, most of them shouldn't be able to buy any of this.
Absolutely. So it is still touted by the vaping industry as all we want is for people to stop smoking. That's all we want. And when it first came out, the FDA has the right to regulate this product. But when it first came out, they said, no, we're going to let them wait till 2022 to decide that that's safe. And then a judge last year said, no, you're abdicating your responsibility, FDA. So we're going to make sure that you make people prove it's safer. And so they actually gave a May of this year deadline for companies to prove that the product is safe. And then because of COVID, they got an extension on that deadline. So now they have until September of this year to prove that it's safe. We did allow for Texas law changed in September of last year so that you had to be 21 to buy any of these products. A lot of people don't realize that you can be grandfathered in. So if you were 18 on that day, you can still buy the products. So 18, if you're 18 and a half and up in Texas, you can still buy the products. That 21 law went into effect nationally at the end of December. And then I also just wanted to show you, if they were very, very, very smart in the ways that they targeted youth. This absolutely was not done as a way to target adults. They got celebrities, so it was all over the internet. My daughter's on Snapchat. I'm not on Snapchat. I probably should be. But she says she sees ads for vaping all the time on Snapchat. They're absolutely targeting where the youth are. They also made all of these fun flavors. So you cannot tell me, this is the one on the right is just a picture that I took at a Valero station near a college campus. This is actually CBD oil pods that are compatible with Juul devices. Look, it's Girl Scout cookie flavor, Fruit Loop flavor, berry blast, and gelato. These are clearly targeting children. And the bottom line is, what the tobacco companies know is that if you start smoking before the age of 18, you are much more likely to continue smoking and become an addict and become a daily smoker. 80 to 90% of daily adult smokers in studies started smoking before the age of 18. And the tobacco companies know that, and the tobacco companies and the vaping companies are in cahoots. Altria, which owns Marlboro, owns a 35% stake in Juul. The new CEO of Juul is an old tobacco CEO.
And I'll just add this, Sorry, Casey.
Oh, no, go ahead.
When you talk about whether or not it's an effective way to stop, there was a very disturbing study that was released. I think this may have been 2018 that actually said from the study, 90% of the participants said that after 1 year, they had still not been able to stop. They had even and they're using just the nicotine, and they had, tried even decreasing the amount of nicotine they were using. But after 1 year, they had still not been able to shake the habit. So no, it is not, especially not for the population that I serve as far as teens. It has not been proven to be an effective way to stop.
So is vaping more dangerous, safer than smoking? Like, is it, or is it just as bad?
So if you look at the chemical content, vape products do have fewer chemicals than traditional combustible tobacco. It's hard for us to determine safety absolutely at this point because cancer takes a long time to develop. Emphysema takes a long time to develop. What we do know is that the products in vape devices definitely cause lung damage. They definitely cause some changes to your vasculature and your responsiveness to your vascular system, which is bad. And can definitely cause overdose and poisoning if taken directly. So maybe combustible cigarettes, you could say, is worse for you, but it's not like vapes are so much safer to make it worth the while. One public health official, when I went to their lecture, described it like this. Yes, snorting cocaine is healthier than crack cocaine, but it's cocaine. And I think that about sums it up.
Well, there you go. I like that. So what about kind of this, you mentioned the respiratory issues, and I feel like maybe 6 months ago, I was seeing news story after news story of teenagers finding themselves in the hospital with lung damage, collapsed lungs, they couldn't get better, some young people even dying, and they all attribute it to vaping. I'm not seeing so much of that now, and that could just be that the news cycle has changed somewhat. But talk about that, kind of the direct health risks that we're seeing, not these long-term ones, like you said, it takes years for cancer to develop. But what about kind of these immediate things that we're seeing with young people?
Yeah, so you're talking about what we call E-Valley, or e-cigarette vaping associated lung injury. And that definitely peaked in incidence in September and has been going down, but is still there. I have a slide on that as well. But it is definitely complicated at this point by the fact that we are seeing COVID, and COVID has the exact same symptoms as E-Valley. So it's definitely complicated. And a lot of people are questioning whether kids who vape are having a worse response to COVID, and how much of that can you say is E-Valley and how much of that can you say is COVID. There's some data to suggest that in the United States, we're having worse outcomes with younger people than in other countries. And part of that may be due to vaping. Part of it may be due to increased obesity in our population as well, but they definitely think that vaping may be a component of that as well. So I think that all of these things are kind of coming together and muddying the waters to tell what is COVID, what is E-Valley at this point. They did trace about 80 to 90% of cases of E-Valley back to something called vitamin E acetate. That was mixed with the THC, and that causes about 80 to 90%. But when you go back to people, there's a good 10% of people who never used any THC. They test hair, they test urine, they can prove that they don't have any THC in their system, and they still got E-Valley. So, and those people just bought like plain old Juul pods from their local Walmart. So, I think part of the decrease has been getting rid of the vitamin E acetate and hopefully people smoking less THC, but that's why it's not completely going away. Hopefully that answered your question.
Yeah, and so that That leads me to wonder, do we know how many young people, how many children, how many adolescents, how many teenagers are vaping? Do we have any idea?
Yep. Let me pull those slides up too.
Because I can imagine that some of you are parents of preteens and teens, and you're wondering, how likely is it that my kid, friends of my kid, kids in my kid's classroom are vaping, or is this some kind of netherworld, not in my house, not in my community thing?
Yes, it is crazy how popular it is. And what disturbs me even more is when I talk about it, my daughter laughs at me because she says, Mom, it's so much worse than that. So here you can see, this is the data for Texas. And I got this from a lecture I did on this with the Council on Recovery. So this is their slide. I want to give them credit for this. But so this shows a state and then our region within Texas. And you can see by grade, if they have ever used vaping products. So by grade 12, you have almost 70% have used some kind of vaping product in our region.
So Bianca, you work directly with this population. Does this accurately reflect what you're seeing in the kids that you deal with every day?
Yes, sadly it does. And just to kind of echo what Linda said, if you'll think about it for a second, vaping was the epidemic that kind of, like had all of our attention before COVID-19. So one thing I do try and do is educate my students on not just, like we say, the respiratory issues, but all of the issues with the central nervous system, how it impacts the undeveloped brain. And I talk to them about how, if you'll look at some of these devices, some of the mouthpieces are literally traps for saliva. We know that saliva is a way to transmit infection. So it's all complicated now. Also, back in September, I can't remember if it was September or November of last year, ABC 13 right here in Houston actually aired that vaping had absolutely hit our elementary campuses. So yes, these are reflections. Sadly, just like we talk about the numbers for, COVID cases, I think that we are definitely behind. I think we're off a little bit. We're doing much better with the numbers. But sadly, this is a reflection. Right now in the Houston area, we're looking at about 1 in 5 middle schoolers very early now. And so even now with prevention, there's a lot of research that says we should be doing prevention and having these discussions as early as 3rd grade. But you all know that I have yet to find an elementary campus that will welcome me in. They're just not ready for these conversations. But that's what we should be doing as early as 3rd grade, talking about the dangers of substance use, especially vaping, because these may be some of the first substances that they're offered.
And Bianca, you mentioned something that I don't know that everybody knows. You were talking about how the saliva, the way the devices are made, the saliva gets trapped in there, and that's how you transmit viruses. So what you're really saying is that kids are sharing these things, right?
Absolutely. Absolutely. Some are disposable, definitely shouldn't be shared or used multiple times. And another thing with these devices is they can be pretty complicated in the way that they need to be cleaned, especially if they're using a device to do what we call like dab or dabbing, one where they are specifically using it for THC, extracts or other things. I mean, you've got to take these things apart, clean them very well. They come with tools to clean them well. They need to dry completely before you use them again. So what we see is, let's say I confiscate a device, maybe 1st or 2nd period, that same student, by just sending a story, a message, or a DM to someone, has already gotten another device by 3rd or 4th period. So unfortunately, there is some sharing, and I do educate them on the health risk of the sharing.
They're doing some studies now to look at the aerosol that you breathe out as well, and that's a great place for coronavirus to sit and spread.
Wow. So I also want to remind everybody who's listening and kind of watching with us right now, we are going to take your questions probably in another 15 minutes. So we'll be doing that through the chat function of Zoom. So don't drop off if you've got some questions that you'd like to answer, because we are going to take some time for that in about 15 minutes. So we've been talking about the respiratory issues, and Bianca, you touched on kind of how it can affect your brain and neurological issues and development, especially for young people. what other kinds of things are we seeing as dangerous to our bodies due to vaping? Are there other things that you guys are seeing in the research that vaping is having a consequence on?
I'll say this really quickly, and then I'll let Linda have this one because I, always love to hear the medical perspective. But there's something that actually the teens themselves talk about a lot, and it's actually called the vape tongue. Literally, where you develop like this, almost like issues with taste buds, to where like they like no longer want even in some of their favorite foods, or like they build up almost this immunity to some of the flavors or some of the different like milligrams of a concentrate or a substance of dating, so then they need more. So that has, is very interesting. I'm anticipating more research on that. Even just this, some dentists came out with some concerns about oral health for our teens. Of course, this is very premature, but again, I'm anticipating that we will see this. But like everything else, this is going to take some time.
Yeah, it's interesting. They had a case report in the Pediatrics Journal this month, actually, of a kid who daily vaped and had lost 25 pounds and was having a lot of abdominal pain. And they admitted him for a workup, and we're doing this huge abdominal workup, and happened to get a little bit of his lungs on the abdominal CT scan and saw that it was actually E. valley. So he was having all of these abdominal symptoms from actually the vaping. So that was something new reported this month. Certainly, we know that you can get nicotine poisoning. So we've had high schoolers who've had to go to the emergency room because they've had nicotine poisoning. I teach all our physicians that nicotine poisoning will look exactly like an anxiety attack. Rapid heart rate, feeling short of breath, feeling dizzy, feeling really anxious. So I do teach all of our providers that if someone's coming in with increased anxiety, we need to ask about nicotine exposure. The other thing to know is that living in a home with someone who vapes has risks. So, I'm a pediatrician, so I'm taking care of toddlers too, and a lot of their parents are vaping. There have been a case of a death in a toddler. Those little flavors that you see that were Girl Scout cookie flavors, they smell like Girl Scout cookies. So, the toddlers will drink those and can get nicotine poisoning that way. And then also just, everything you breathe in, you breathe out. So all those chemicals, carcinogens that they're breathing into their lungs, they're breathing out. Since it is an aerosol, those little particles land on stuff, and toddlers can't, they touch everything, they touch their eyes, they touch their mouths, and so all of those chemicals are getting into them as well. So they've done urine tests to check for nicotine levels. Concertine levels is what you actually check in the urine for people who live with people who vape, and they can find it in their urine. So it is getting into their system as well, just like secondhand smoke.
And so I'm guessing parents don't know that their kids are doing this, right? I mean, is that kind of the consensus, is that for the most part, parents don't know? Or is it kind of a mixture of parents don't know or parents don't know how to deal with it? I'm guessing it's probably a little.
Yeah, I think it's both. And I think there's widespread misunderstanding that this is safe. So I know kids who do it with their parents. So the parents are vaping and the kids are vaping too. There is this kind of widespread belief and perpetuated by the vaping industry that this is a safer alternative than cigarettes. When I talk to my teenagers who are vaping, a lot of them think it doesn't have nicotine in it. And they've done a lot of studies that show that a lot of teenagers think that there's no nicotine. They're just vaping flavors. There's no nicotine. And once again, they've done studies where they test their urine and there's nicotine in those kids' urine. So is possible to get vaping liquid that is just flavor, but that's not what's in the pods, and that's not what most kids are using.
She's absolutely right. The only thing I'll add to that is just an interesting story of a student who had been, telling a parent, it's just air, it's just water, it's nothing. And, having to have these difficult conversations with a parent to say, but if you put this consequence in place, that consequence in place, and you notice that your child cannot put this thing down, when have you ever not been able to put down a cup of water? Okay, something else is happening. I need you to start there. I need you to look there. I mean, these teens will even tell a teacher, you know, that's my body spray, that's my perfume, because sometimes they give off no smell at all. Sometimes they give off the, you know, a fruitiness, or like she said, whatever flavor you're using, that's the smell. But, you know, not smoke or anything close to that in most cases. But it's definitely both a mixture of just uninformed, but then sometimes that is also a part of the family culture where they're doing it together because they're just not aware of the risk. And for them, they see it as better or safer than a combustible cigarette.
So Bianca, do you have kids that you see and that you talk to that want to quit?
Absolutely. And it's actually very, very sad. Reason being is because there is no specific therapy or modality right now for a vaping addiction. Literally, what we do is we just kind of pick and pull from the same things, or same modalities that we use for a person who's part of a smoking cessation program. But again, that physical part, that psychological part is going to be the biggest thing. So sometimes it gets down to encouraging the students to keep snacks with them, to keep the mouth busy with other things, something salty, something crunchy. Noticing that I took a device from a student on Monday morning, and by Monday afternoon, the student is chewing sleeves on a shirt, backpack straps, chewing up the end of a pen or a pencil. So it's actually, it's heartbreaking to see. And when they come to you and they say these things, like, I actually want to stop. Linda mentioned some work with Counsel and Recovery. I also do some things with them. And so there are some, you know, some teens who are in treatment who will say, I'll stop this drug, whatever that drug was, but they will say, I don't think I can ever give up my vape. Like, I don't think I can. Or they'll just say, that's not what I'm here for. That's not my goal.
Nicotine is one of the most highly addictive substances out there. So it's hard. You definitely hear stories about kids waking up in the middle of the night to take a hit because their nicotine levels have gotten too low.
And so what can parents do? You know, if they figure out, you know, they're smart enough to figure out they've got a kid who's vaping and the kid is actually relatively receptive to not vaping, it doesn't sound like there's a whole lot in the way of either resources or a real concrete plan for helping kids to stop.
I'm going to share a list of resources, and y'all can take a picture of it with your phones, because there are some resources out there. There are people working on this. So these are some different resources that are out there. The teen.smokefree.gov is a great website, and that's run by the National Cancer Institute along with others. Thetruth.com, where it has a text line, and I've gotten all these texts, so before I give it to my patients, I wanted to make sure it was okay. And so yes, that's a good resource as well. Or the Texas or National Quit Line all have resources to help you quit. The CDC and the American Academy of Pediatrics are also good resources. Hopefully you can go to your pediatrician as well. If it's both a psychological and a physiologic addiction, so you're addicted to the nicotine, you can use nicotine patches and gum, but for under the age of 18, you need to have a prescription to use that. So you will have to go to your doctor and ask for that. But you know, there are resources out there. I don't want people to think it's a lost cause or to give up, because it's so important. I think even more than that, there's been a lot of good research to show that a lot of simple things we can say help get kids from starting in the first place. And that's where the power really lies. So we've done this before. If you saw that original slide that looked at the rates going up and up and up, you notice that traditional tobacco was going down and down and down. So we had this great public health triumph with traditional cigarettes. And the way we did it is by changing our messaging to youth, to get them to rebel against the tobacco industry instead of rebelling against us. So what you want to do is, when you have someone who's not smoking or vaping, and what I teach providers to say when they have someone who's not smoking or vaping is say, oh my goodness, I am so glad you're so smart not to do that. They are spending a lot of money right now trying to get your generation addicted to vaping. And I'm so glad you saw through those lies. And so when I've gone to middle schools where they're having campaigns, that is the messaging that they're sending, that Big Vape is lying to you, rebel against them.
Absolutely. I have to echo that. That's literally, so the program that I basically facilitate for the school district, that's the message. The message is, it is not me or your parents against you. It's actually us against the big tobacco industries. I mean, that's our go-to. And this generation, they actually are very receptive to the information that sounds a lot like, just education, just facts, and not so much me fussing, or just telling them, no, without telling them why. Another thing is, I am always transparent with them about the fact that the nicotine withdrawal symptoms will start to subside over time. Like, hey, I know today, tomorrow, this week, and next week may be tough, but this time next month, check in with me. I'd like to know how you're doing, just to let them know that it does get easier. Also, active coping. Okay, I mean, that's our go-to. We want to keep them active, and we want to bring them into these conversations and give them a platform. And they're going to say some things that can be very disturbing. I literally had a student to tell me, because they are so adamant about wanting to quit, she knows which restrooms on campus are safe and which ones aren't. She knows which ones are further away from administration or from adults where people are going to be vaping in the stalls. So she uses the other restrooms. She's empowered because of some of the conversations we've had, but then she also has to turn around and educate me on, okay, you're telling me this in this setting, what could help, what could work, but I'm telling you what really works for me in my day to day. And so, it's definitely a partnership that happens. And they love the text lines and the hotline. They love to be able to stay anonymous if they want to. They'll call and say, tell me, they say things like, I got a friend of a friend who's struggling with this, and they like to get information.
So I'd like to open it up to some questions, because I know we have so many people joining us today. I'm thrilled with that. So if you guys do have some questions, there's a little chat box, and I can see we've got one question down there already. Just click on there and you can just type your message in. Anna sent this one in. Bianca, is directed at you. She says that you mentioned that school districts, along with school campuses, have been reluctant to welcome educational content to start early conversations with students about substance abuse along with vaping. What can we do to encourage those school districts to have the conversations and allow experts into the campuses? And then for Lindy, you mentioned that the FDA has extended their deadline to prove the safety of vaping. The FDA is a national entity. What kinds of things are happening at the state level, and what can we do to hold these companies liable? So Bianca, why don't you start by talking about, how as parents or community folks, we can get our school districts to take part in this?
Absolutely. Even when they're reluctant to these very transparent conversations that I like to have, what I like to do is to encourage them to allow me and others to come in during their red ribbon week. Sorry. So usually that's something that's pretty standard, pretty universal. And then just taking that opportunity to basically take the conversation a bit further. Okay. Just the amount of information that children are able to process and understand at as early as third grade blows my mind. And so just us being consistent about saying what it is that we feel is helpful, so we start those conversations at home, and whether it be us volunteering as individuals or getting organizations to go in, taking advantage of red ribbon week. Another huge one, which is sad because, this whole thing has us all over the place, but World No Tobacco Day, which is May 31st, even though it falls on a Sunday this year, it's a great opportunity to go into the schools on either the Friday or the Monday, just offering education. Not to scare anybody, not to lead with the fear factor, but we want our kids to be really, really smart. And so those are examples of just taking advantage of, holidays, days, things that are already seen as tradition, and just going in and having conversations.
So Lindy, before you get answer Anna's question, I had a follow-up for you, Bianca. So I can see schools, teachers, principals saying, I don't want you to come into my elementary school because I don't want you introducing this to them. I'm sure you've heard this before. What's the argument for that?
We just don't, there just really is no research evidence that says the moment I introduce this conversation that it sparks their curiosity to the point to where they say, I'm going to go and try it. But you're absolutely right. I get that a lot. And what I usually try to let them know is things are just different now. We need something that's much more effective than what we saw with our traditional DARE programs, things that I had when I was in school, okay? We need to have real conversations. It's not me going in and offering substance use treatment or therapy to a third grader. It is education. And I think that there's always room for education, no matter how young. And until our school districts are on board, I am absolutely encouraging every parent to start these conversations at home really, really early.
So Lindy, so Anna wanted to know what we can do and if there's anything happening at the state and local level about vaping.
She is speaking my language. I love advocacy. I want us all to be more involved in advocacy. And I'm going to show you exactly what's going on the state level. So I was testifying actually in front of the Senate Health and Human Services Committee this December, kind of before COVID, but this is something that the governor has placed a priority on, and certainly health in general is going to be a priority this next legislative session. A lot of the advocacy does happen at the state level for this, not the national level. So it is important to know who your state representative and senator are and make sure that they know that you're concerned about this topic. So some things that we would like to get done, we need to increase the taxes on conventional cigarettes by at least $1 a pack and impose a tax on e-cigarettes. So right now, e-cigarettes are not taxed the same way traditional cigarettes are. Traditional cigarettes have additional taxes to help pay for the healthcare we have to provide to people who smoke cigarettes. So that is something that we would like at least parity on and would like to increase the amount. That has been shown to decrease youth smoking more than anything else, just increasing the price by $1. Obviously, we would like to ban all flavors, including menthol. Flavors are the main reason why teenagers say they start vaping in the first place is because of flavors. So we'd like to get rid of all of them. Nationally, flavors except for menthol and tobacco flavor have been banned in pods, but only in pods. So you can still buy the liquid in any flavor you want. So we would have that banned from everything. And then this is another kind of tricky thing, but it's extremely important. So right now, if you want to sell tobacco, you have to have a permit to sell tobacco. But all of these vape shops that you're around, you'll notice, do not sell traditional cigarettes. And the reason why is then they don't have to be permitted. In order for law enforcement to be able to tell if they are not selling to people under 21, if they're following laws, they need to know where the sellers are. And right now, the state of Texas doesn't even know because you don't have to have a permit. So it sounds like a really technical thing, but it's actually very important as well. So please, 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 let your state representative know that this is an important issue to you and something you care about. And then get involved when the legislative session starts, which will be in January.
And just to add to that, this is another area where it's amazing to get our teens involved in these conversations. Speaking of, just the legislation, there was actually a teen in Fort Bend County who kind of led the way for a lot of the legislation, the ban, and some of the advocacy efforts there. So, if you have children or young people in your life who are also passionate about us just being healthy and fighting against these tobacco companies, bring them into these advocacy efforts and these conversations. Sometimes they'll listen to them before they listen to me, so it works.
So who else has got questions out there? There's quite a few of you in here today. So I have a question while we kind of let people type. So we were talking about some of the resources, and I noticed that thetruth.com was on there, and I've started to notice, and maybe it's because I knew I was moderating this talk, but I've started to notice those commercials that they have where they've got all these kids doing their cell phone tricks to destroy their vaping devices. I wonder, first I have two thoughts. One, I wonder if that's effective with kids. And then my second part of that is I'm guessing that I should be using that as a jumping off point for conversation. I'm assuming Bianca's going to say, yes, you absolutely should be talking to your elementary school kid about this now. And it's something I didn't even think about because she doesn't know anyone that smokes. She doesn't know anyone that does drugs. She doesn't know anyone that does these things. So I didn't even think about it being an issue, but it sounds like that's probably something I should be thinking about.
Absolutely. And, you know, just keep on terming it. It's like, oh my goodness, I can't believe these kids are falling for this message. You know, I'm so glad you're smarter than that. And, you know, just kind of pointing out different ways. So, you know, along with all that other stuff, and this would be something that needs to happen on a national level, is advertising. There are no advertising rules for vaping like there are for traditional cigarettes. They're not covered under the advertising rules. So they can advertise wherever they want. So you hear it on radio. I don't watch much live TV. I don't think they do much live TV. They get a lot of, well, the bottom line is actually teenagers don't watch much live TV. So why would they advertise there? So they're advertising where teenagers are. But absolutely, every time you see one, I would have a conversation about it.
I'll add this too. So sadly, there was a situation where a teen was actually basically targeted, if you will, and ended up receiving like a sponsorship from Juul. Yeah, so this person claimed to be like what they will call like a vape god on YouTube, had several subscribers and views for basically the tricks that they blow with their device. And of course, it took other students to kind of let me know what was happening. But of course, I used it to guide the conversation back to what Lindy has said as far as this is why it's us against them. Like, look at how they're basically using him, manipulating him. Yes, he'll receive, you know, A, B, C, and D, but let's talk about both the short-term and the long-term effects of this. But it's those reasons, you know, they find every loophole. They know where they are and aren't regulated, and they use it to their advantage. Another thing, thinking about the elementary schools, so thankfully, ABC 13 kind of put it on everybody's mind late last year that this has reached our elementary campuses. But there was also a situation where there was a fall festival. So this is a school event at a school here in Texas. School event, fall festival, middle school student in the restroom, elementary student in the restroom at the same time. Another elementary student walks in and sees the middle schooler basically pressuring the elementary student to take a hit of their vape. That student then runs out of the restroom. Fall festival, thankfully parents are there, and then reports it to the parents. Hey, you know, didn't even know how to describe what was going on, but knew something didn't look right about it. The elementary student who they were aware of, familiar with, just didn't look comfortable in the situation. And so, you know, just talking to them sows a seed so that they know when they see things, when they hear things, when they smell things, you're just opening the door for lots and lots of education.
Yeah, and I have another, we're talking a little bit about advertising, another fun graphic to share. And this shows you how they took old cigarette ads and turned them into vape ads. So they model, they knew exactly how to do this. They've done it before. So there's a group out of San Francisco looking at this, but it's just amazing. Just a one-to-one correlation.
So we had another question about any studies out there on vaping and brain functions. We talked a lot about the lungs. What about vaping in your brain?
Do you want me to get that? So we know that it targets the part of the brain that looks at reward. And that's why people under 18 are more susceptible to it because that center they're more susceptible to anything high risk. That reward center goes off stronger in adolescents than it does in adults. So we know that nicotine in and of itself does have long-lasting effects on attention, learning, and memory. And it also has been tied to impulsivity and mood disorders. It hasn't been around long enough for us to do something like an MRI or functional MRI to see actual brain structure changes, but we know from cigarettes and nicotine by itself that nicotine in and of itself does this. I don't know all of the brain effects from all the different chemicals that are in vape products. Once again, these have not been tested to be inhaled. They are, all the flavors are generally recognized as safe, and that's a FDA regulation, GRAS, generally recognized as safe, but for ingestion, not for inhalation. When you ingest something, it goes through your liver, it gets metabolized. It's very different than taking a straight hit to your lungs. So we don't know all of the consequences of that yet.
So we have another question from FLC saying, thank you so much, such relevant and timely information. They also want to know if there are any resources such as links to short videos that you can share that are aimed at prevention/education targeting middle school age kids to counter this marketing of e-cigarettes and vaping. You guys have like the websites that you showed earlier. Are there things on there that are specifically targeted as education tools towards middle schoolers?
Yeah, the Truth website is actually great for that. And it's really targeted. They have a whole section of their website that's targeted towards middle school, high school students. The fun thing to know about Truth, it is a nonprofit organization, and the funding from that was actually the big tobacco settlement years ago. So that's how the Truth started, because the tobacco companies had to pay a lot of money for false advertising back then. And so now that money is being used to help counter vaping now.
Yeah, and back to CDC, they have some amazing information, a whole section basically on vaping, which is great. And then drugabuse.org. Both of those are really good. And what I do, usually the only time I worry about differentiating between the type of information I present is obviously primary versus secondary. So I can present the same type of information to my elementary students. And then for middle school and high school, I just do the same. Again, it blows my mind at how they're able to process that information. Usually it does not need to specifically be for middle schoolers. The big thing is knowing that actually that's the peak time. Usually they're at an advantage if we get it to them in 6th grade, where there's lots of pruning and sprouting, as we say. They're more of a sponge at that point. But I don't worry so much, even if it is for high schoolers. I usually just say, hey, I know this stuff's for high schools, but don't worry, by the time you all get there, you're going to be very, very smart. And they can handle it.
Do you guys feel like using things like those videos are helpful when you're trying to have this conversation with kids?
Yeah, I think anything that's a starting off point. And then I think like every conversation, every important conversation we have as parents, it's not one conversation. It is a bazillion conversation. It is when you're walking by and all of a sudden you smell Starburst. That's probably someone vaping in the crowd, and it's having a conversation about it then. So, just like the sex talk would be a lot of conversations, not one conversation, talking about vaping would be as well.
And it helps when what they see or who they see looks like them. So with the Truth and some of those other organizations, for them to go on there and see people who look like them, or at least close to their age, that is effective. There's also different things on, like the CDC website. I'd probably end up being the weird parent who prints the infographics out and puts them all over the house, just because I'm like, you know what? If the conversation isn't enough, this is kind of all in your face right now. But, they, in their own time, in their own way, they generally are very receptive. But like Lindy said, it's just, time and time again, just sowing that seed, and before you know it, sometimes I walk up on conversations where they're educating their peers just based on a conversation they've had with an adult. And it's helpful.
So I'd love to hear from each of you. You guys are both very much in the trenches, so to speak, with this issue. So Lindy, I'd love to start with you as a pediatrician. What are you seeing in your practice that directly relates to vaping? Are you seeing kids coming in, or is it more, like you said, is it secondhand with most of the kids that you're seeing? I'd love to hear kind of your own firsthand take of what you deal with every day.
Honestly, it's when I'm countering it in my practice, it's normally because as part of a adolescent well-child check, we ask about smoking, vaping, all of that kind of stuff, alcohol use, drug use. And so it's mostly coming up in those type of conversations. And then once again, just reinforcing with my colleagues that it's so important to ask, and it's so important if they say they're not doing it, to reinforce that that's awesome that they're not doing it, because it's easy to just, you have this long checklist of things you need to talk about, and it's easy to skip by that. But we know that that one statement can make a huge difference in preventing kids from starting in the first place. So hopefully your pediatrician's having that conversation with your adolescents. When you go to the doctor with your adolescent, they should be asking the parent to leave the room and talk to the adolescent one-on-one. Please trust your pediatrician if you don't find a new one. and leave the room and because that's one of the things we're talking about. And we're trying to reinforce healthy behaviors in your child. So if they say they're not doing these things, we are telling them, great job, I'm so proud, that's awesome, and that has been shown to help.
And so that brings me to, do you think kids are telling you the truth? And I imagine if the parents aren't in the room, it's a little more likely they will. And then do you then have a conversation with the parents, or are the kids your patient, therefore you can't tell the parents?
Yeah. So anytime we're talking to the kid alone in the room, we talk to them about confidentiality. And actually in the state of Texas, drug and alcohol use and sexually transmitted disease are two things that we are allowed to keep private. And that is so for a good reason, because otherwise they wouldn't tell us at all, obviously. Certainly if they're doing these things, we would encourage them to talk to their parents about it. I would always say, I'm happy to sit in with that conversation, or, tell them if we need to. Normally they don't want to tell. And I'm positive some of them are lying to us. I know that because we have people who say that they're not sexually active and then come back the next visit pregnant. But I think enough people are telling us the truth that it's still worthwhile to ask. Because I certainly get a lot of positives on all this stuff as well.
And Bianca, what about you? What is your kind of day-to-day experience as you talk to kids about vaping?
So typically this is going to be my high schooler. So of course, much more vaping incidents on my high school campuses than the middle schools. Sadly though, with what I'm saying, it's more of THC. So more THC, the concentrates and the extracts, a lot less of the nicotine. Sadly, I am seeing my students who are using black market products or just ordering online from dispensaries in California and other areas. Sometimes they're very transparent. They'll even tell me, yeah, I can get it with no problem. Usually there's some simple pop-up window that says, are you 21 or over? And I just hit yes, something really simple. Just like Lindy said, when they see me, we have an assessment. And during the first maybe 30 minutes of the assessment, the parent is there. I do ask for the last 30 minutes that the parent leave the room. Sometimes they don't want to. But very interestingly, the students will say to me, in the next visit, hey, last time I know I said this, but it's just because my mom was there or my dad was there, So you get to see the ones who actually want to change, who actually want you to know, who actually want some information, who want some help, but they are, of course, worried about those consequences. We also respect confidentiality, but then there are times when I will preface a question with, now, I do want you to know this I will need to share, or are you okay with me sharing? Same thing, would you like for me to be present? How would you like us to have this conversation? Because clearly if your student is caught on campus with a substance or under the influence of a substance, we've got to call just to handle the disciplinary side. Like now they're about to go to ISS or OSS, or they'll, be ordered to take some program after school. So they understand that it's a little different there. So sometimes it takes much longer before I can get that information out. Maybe it's the first 2 weeks in and they're still saying, no. And then maybe by the time we get together for that 1 week where they're with me, an hour and 45 minutes for 5 days straight, when they finally say, okay,
So we had another question from the group. Any advice for adults that are trying to help their family members stop vaping? Either one of you guys want to tackle that?
I think part of it is just making sure they're well informed. Once again, I think that people just think that it's safer. So, getting on those CDC websites and making sure they understand that vaping is not low risk or zero risk to do. So, I think that that's kind of the starting point, because most adults I hear about vaping are smoking as well, and are trying to get off of smoking by vaping. So, I think that's the main thing. And then just kind of everything we do for adults to try and get them to stop smoking as well. I always try and target parents of newborns, because if you're not going to stop for your newborn baby, you're probably not going to stop. So that's a great time. So thinking about transition times for people and having that as a time to stop vaping. And then I'm sure Bianca can talk a lot more about this.
Sure. My big three are usually educate, encourage, and validate. Just like Lindy said, give them that education, okay? Encourage them. That's going to be tied to the education. Validate. Let them know that it must be tough. Let them know that you now know that nicotine is one of the most addictive substances. Let them know that you know that this stuff is kind of all in your face. Again, you could be going in to pay for gas, and now there's this little display with all basically these devices and instruments. Some are shiny, some look cheap, you know? We are seeing everybody from a CEO who vapes in between meetings to, you know, celebrities and rappers who push luxury vapes and their own juices and flavors that they've come out with, to people who are battling other addictions who can now use basically more discreetly, you know? So educate, encourage, and validate for sure.
Does anybody else have any kind of final questions before we wrap up our lunch and learn? All right. Well, ladies, thank you so much. Dr. Lindy McGee, thank you. Bianca Smith, thank you so much. This was really educational. And one of the things I love about the Women Fund talks, whether I'm moderating them or just watching them on Facebook Live, is no matter kind of where I'm coming from, I always feel like I learn so much from what you guys are talking about. So thank you both for being here today.
Thanks for having us.
Yes, thank you, Lindy, and Bianca, and of course, Casey. What a great conversation today. I want to thank y'all for taking time out of your private practices to be here. I think it's a very important conversation we needed to have. My 17-year-old grandson lives with me, and it's something I'm constantly looking for to ensure that he's not doing that. If you enjoyed today's program, please find us on Facebook. We do post things there, and our other social media. Or we currently have virtual programs scheduled through June the 10th, and we will be adding more as we go along. So please go to our website, thewomensfund.org, to see a complete listing of the programs we have now. They're typically on Wednesdays at 2 p.m. And if you have any ideas or topics you would like us to cover in Doc Talk, please, in your chat feature, please send us a message so we can, explore and work on those. And so, again, like us on social media. We have a Twitter, Instagram, and Facebook account. And that is really it for today. Thank you for being a part of Doc Talk. And we are planning our next Doc Talk for August. We have a date possibly, but we haven't determined the topic yet. So your topics, we'll consider them. And that's really it. So thank you again. We're going to stay live for a little while longer. So if you do have topics, we can capture those before we end this conversation. Thank you again, ladies, for sharing your expertise with us.